Hello everyone, my name is Camille Agudo and my PowerPoint presentation is about a disease known as Fibrodysplasia Ossificans Progressiva. Fibrodysplasia Ossificans Progressiva is a rare disease which our muscle and connective tissue is calcified and converted to bone. It builds an entire new skeleton from our muscle and encloses our natural skeleton just like in the picture that I provided to the right of the slide. This disease is rare due to the main reason that it converts our muscle system to another new system. Some interesting demographics is that this disease attacks 1 in 2 million people. Fibrodysplasia could attack anyone, no matter who the person is, whether ethnic, race, or gender patterns. There is around 800 cases across the world in different countries. The United States have at least 285 confirmed cases. One interesting fact is that females have this disease more than males. There are 445 females and 387 male patients who have this disease. We have a gene named the ACVR1, which is a protein that utilized for the development and repair of our skeletal system. A glitch happens within the ACVR1 that causes abnormal activities in which it creates bones from muscles and it is considered a secondary skeleton. This mutation causes our endothelial cells to turn into mesenchymal stem cells and then finally to bone. On the right side of the slide, I provide two pictures of this gene and its structure. This disease starts at an early age, when it becomes more noticeable such as flares up and the great toe on a child just like on the picture that I provided here. Misdiagnosis of this disease occurs, but it could be avoided by checking the person's toes for the short great toes with an evaluation, physical exams, and finding of the ACVR1 gene. As time keeps passing by, muscle starts to become calcified and slowly lose their mobility in their body. Patients are supposed to be handled in a protective manner because it will speed up the process by trauma such as injections, falls, or hitting themselves that could affect the muscles in a negative outcome. Death becomes imminent for the patient and they barely survive through the age of 40. This disease starts at tendons, ligaments, and tissue that support muscles. The neck, back, chest, arms, and legs are first area to get compromised, and then to the hips, ankles, wrists, elbows, shoulders, and jaw, as well as the abdominal wall. This will give the patient with barely enough mobility for themselves. Death occurs by many muscles become calcified, such as the muscles around your chest, and it deals with breathing problems, especially the heart because it is technically a muscle. So if the heart is calcified, you will eventually pass away. This slide I provided pictures of how the disease progresses into the severe level. The top three pictures are scans of the body in which bone has been created on the outer side and starting to cover our skeleton system. The bottom three pictures show how the calcified bone is starting to become noticeable outside the body and how the person on the left side has his body curved just like scoliosis. As of now, there is no real medicine or real treatments to get rid of this disease. We only have medications that could prevent the process at its slower phase. We have corticosteroids, which helps for inflammation and swelling. Then we have NSAIDs to reduce inflammation. Then finally, we have thalidomide, which is anti-angiogenic, which modifies the immune system responses. Surgery could be an option, but it leads to negative reactions because the calcified bones that were removed will grow again at a faster pace and lead to bad outcomes. Affected individuals usually get support from occupational therapy. There are special shoes, braces, and devices that will help in walking for people with FOP. Doctors usually help by accommodating individuals with a therapist. One day in the future, we are hopeful to get a real treatment or a cure to finally put the disease to an end. This is my works cited that I use for this disease, and I hope everyone got a better understanding of Fibrodysplasia Ossificans Progressiva and how much of a rare disease it is, known for converting the muscular system to another system. Thank you.